So my name is Kim Gokoffski, and I'm an assistant professor at the University of Southern California.
Please share with us what you presented on here at ARVO.
So the overall goal of my lab's research is to develop a technology to regenerate the optic nerve. So the optic nerve is the cable that connects the eye to the brain, and it's selectively damaged in a number of conditions, with the most common being glaucoma. And so it's actually estimated that about 18 million people worldwide are legally blind from advanced diseases that affect the optic nerve. The optic nerve is unable to regenerate itself, and so the only way to restore function in patients who are blinded when they have damage to the optic nerve is to regenerate it. And so the community is relying on stem cells in order to provide healthy cells to replace the optic nerve. The problem is that when we inject these cells into eyes, they can integrate into the retina, which is the back of the eye, but they don't extend their projection from the eye into the brain. And so it suggests that a cue, like an external cue, is needed to direct that growth. And so people generally look at it as you need two different types of cues. You need gas in order to drive the growth of this projection, and then you need steering in order for it to grow to the right direction. And so my lab is focused on providing that steering cue. And so what I would like to use are electrical fields in order to guide what we call axon growth. So axons are that connection between the eye and the brain.
How are you making these connections?
Electrical fields actually naturally exist in our body and are actually thought to guide and direct tissue patterning and growth during development. And so other groups are interested in using electrical fields to help regenerate the spinal cord. And so my group is interested in seeing if this can be applied to the optic nerve and to restore vision in patients who are blinded by, conditions like glaucoma.
How are the electrical fields being used with the stem cells?
So the hope would be that applying these electrical fields would help guide these stem cells to help reconnect with the brain.
What are your next steps in this line of research?
Right, so currently we've been able to show that these cells that make up the optic nerve, that they respond to an electrical field in tissue culture experiments. And currently we're working on developing the technology and testing whether this, one, can be safely applied to animals that are alive, and two, whether this actually will work in vivo. We're currently working using a rodent model, but once we're able to demonstrate that this works, we would move on to larger mammals and then eventually into phase 1 clinical trials.
How can someone follow your research or get involved with your clinical trial?
Online at the USC website. In addition, once they're diagnosed with glaucoma or another condition in which their optic nerve is damaged, they would need to ask their ophthalmologist or neuro-ophthalmologist for any clinical trials that are available, and then in that way they would be connected with trials.
How do you feel this treatment will translate into patient care, and about how long before it will be available?
Generally, the dream would be to have, if we had patients who were interested in this therapy, then they would get referred, and then they would need to undergo kind of stepwise treatments, which would include at some point an injection with these stem cells into their eye, and then implantation of a device to help apply the electrical field to the optic nerve, which is behind the eye. It's always hard. I tell my patients that a lot of progress in medicine and science gets accomplished even in a short span of period like 5 years, and so I give them kind of this ballpark of 5 to 10 years. I think that they're going to see a lot of really promising research actually make it to clinical trial level.
Do you think this therapy could translate into a treatment for macular degeneration?
Both conditions do rely on stem cells to try to help replace these cells because they can't replace themselves. They're distinct populations, and so it probably wouldn't be as useful for patients with macular degeneration.
Are there other projects you are working on in your lab that you'd like to share?
So, in addition to this, of course, we're interested in understanding what the molecular mechanisms are through which cells respond to electrical fields. In addition, we're collaborating with the stem cell core group at Children's Hospital Los Angeles, which are using stem cells to generate retinal organoids. And so organoids are kind of exactly what they sound like. They're organ-like, they're organoid, and so they grow using stem cells. They can make these balls that are like eyeballs, essentially. And right now, although these eyeballs form these neurons, they don't form an optic nerve. And so one of the things we're trying to see is if we apply an electrical field, can we actually get these organoids to organize and form an optic nerve?